So I'm currently in the medication room and I'm just looking over my patient's MAR for her medication. I'm looking at her name, her date of birth, her allergies, what medication I'll be administering. I'm administering a 1 ml of sodium chloride intramuscular at 7:30 p.m. or 19:30. I'm also looking at the doctor's orders. I'm looking at her allergies again, double checking safe dose, side effects, and contraindications of the injection. I am going to grab all of my items for preparing this medication. So I'm just going to perform some hand hygiene and I'll explain the medications and utensils used. So I am going to be using 0.9 sodium chloride for her medication. I am going to be using a 22 gauge needle, which is also 1.5 inches, and then a 3 ml syringe because I will be pulling up 1 ml of medication. So I'm just going to clean the top of my medication here with the antiseptic swab and assemble my needle here, and I'm going to pull back 1 ml of air and inject it into my vial. And I'm going to pull up 1 ml. No air bubbles. Double checking that there's no air bubbles and that it's 1 ml. I'm going to scoop it. And I will send you a picture of how much is in here. Here is my 1 ml of the sodium chloride. So before I leave the med room, I'm just going to double check my patient's MAR, Anne-Marie Griffith, her birthday, allergies, what medication I'm giving. So I'm giving 1 ml of sodium chloride intramuscular at 7:30, and I have the right needle. And I also checked before administering or before pulling up my medication that I'm giving the right medication and the right needle and the right ml. So I'm double checking her name, the time, it's 7:30, the medication is sodium chloride, the dose is 1 ml, and the route is intramuscular. All right. Hello, my name is Katie. I'm going to be your student nurse today. How are you doing? Good, thanks. Good. I just have an injection here. It's just 1 ml of sodium chloride that will go in your left arm. Is that okay? Yep. Good time. Okay, perfect. I just have some questions I have to confirm. Can I have your name?
Anne-Marie Griffith,
Your date of birth?
March 27th, 72.
And do you have any allergies?
No.
No? Okay. I'm just going to close the door for some privacy and get everything started. So I'm just going to perform hand hygiene. I would wear gloves if I had gloves here. Just double checking that it is 1 ml of her medication. Double checking again that I have the correct patient. So I'm going to roll up your sleeve here. I'm going to find the bony prominence of your shoulder and go 3 fingers down and then clean there. Let it air dry. I'm going to take off the needle of my medication, find my 3 fingers, and then subtract, and then insert on a 90-degree angle and push the medication in and leave it for 10 seconds so the medication disperses. I would activate my safety guard and throw this in the sharps because it is now contaminated. If she was bleeding, I would hold pressure here. I wouldn't massage it or anything. And as I'm doing this, I'm going to evaluate how she responds to it. How do you feel? Good, good. I would get her comfortable, back into bed, put a side roll up if needed, and give her a call bell. So now that I have given my patient her injection, I'm just going to sign off on the medication here. And then I'm going to document how she responded. I stated here, patient responded well to 1 ml of sodium chloride, intramuscular and deltoid in left arm. I also just wanted to mention the ways that I would evaluate the patient's response. I could take vitals. I could sit with them for a little bit if they are feeling woozy or anything. Sit them down, get them comfortable, stay with them, and make sure everything goes okay. And if anything did go wrong, I would document that.